Intercostal spaces. Intercostal spaces are the spaces that are located between two adjacent ribs, thoracic wall. We have 11 pairs of intercostal space. The last space, which is found below the 12th rib, called subcostal space. So 11 pairs of intercostal spaces and 1 pair of subcostal spaces. The intercostal spaces are filled or occupied by what's called intercostal muscles. These muscles are arranged into groups. The most superficial or external muscle called external intercostal muscle. The external intercostal muscle spans the distance between two adjacent ribs from the superior border to the inferior border. Deep to the external intercostal muscle, we have the second group, which is called the internal intercostal muscle. The direction of the internal intercostal muscles is at a right angle to the direction of external intercostal muscle. We will demonstrate these muscles on the cadaveric samples later on. And the third group, the most deep group of intercostal muscles, called transversus thoracis group. The transversus thoracis group are divided into 3 muscles, depending on their location. The most anterior muscles, called sternocostalis muscle, that span the distance from the sternum to the costal cartilages, internal. And the most lateral group, called the intercostalis intimi muscle. They are spanning the space between 2 ribs. Then we have the most posterior muscle, the transversus thoracis group, called subcostalis muscle. Subcostalis muscles characteristically differ from other intercostal muscles by their length. They span more than 1 intercostal space, usually 2 or 3 intercostal spaces. The first layer of intercostal muscles and the most superficial layer is the external intercostal muscle. The external intercostal muscle extends all the way from the inferior border of the rib above to the superior border of the rib below. The direction of the fibers of external intercostal muscle is downward and anteriorly when we look from the lateral side of the chest, in this way. This muscle, which is clear in this sample, which is found between 2 ribs, span the intercostal space all the way from the tubercle of the rib to reach anteriorly to the costo-chondral junction. At the level of the costo-chondral junction, the external intercostal muscle will be replaced by an aponeurosis called external intercostal membrane. This is the external intercostal membrane. This muscle is most active during the inspiratory phase of respiratory cycle. The contraction of the external intercostal muscle will lead to raising the ribs and the sternum, so increasing the AP diameter of the chest. Now, deep to the external intercostal muscle, we will reach to the second layer of intercostal muscles, which is called internal intercostal muscle. If we reflect this muscle, which is the external intercostal muscle, we will see another muscle which extends also from the superior border of the rib above all the way down to the inferior border of the rib below. This muscle differs in 2 things from the external intercostal muscle. First of all, the direction of the fiber. The direction of the internal intercostal muscle is downward and posteriorly in this direction. In other words, at a right angle to the direction of external intercostal muscle. The second thing is that this muscle spans the intercostal space all the way from the angle of the rib posteriorly to the level of parasternal line. So we can see the internal intercostal muscle if we reflect the external intercostal muscle. Membrane. This is the external intercostal membrane, and the muscle fibers that can be seen underneath it is the internal intercostal muscle. Now we will open the thoracic cavity. We have the third layer of intercostal muscle, which is the deepest layer. It is called the innermost layer, or transversus thoracis group. It composed of 3 muscles, depending on their location. The first muscle, which is located anteriorly, is called sternocostalus muscle. The second muscle, which is located laterally, spanning the intercostal space, the lateral 2/4 of the intercostal space, is called intercostalis intimi. And the third muscle, that is located posteriorly, called subcostalis. Let's talk about the first muscle, which is called sternocostalus. Sternocostalus muscle are transverse slips of muscle that runs obliquely from the internal surface of the sternum. This is the sternum that is cut open, and this is the internal surface of the sternum. The sternocostalus muscle runs from the internal surface of the sternum to be inserted into the costal cartilages number 2 to 6. The third group, or second muscle in this group, is called intercostalis intimi. Intercostalis intimi is hard to be seen in this sample, but it's usually located on the lateral side of the chest, lateral 2/4 side of the intercostal space, and usually they are in the same direction of the internal intercostal muscles. Now the third muscle, the innermost layer of intercostal muscles, is called subcostalis muscles. We can see here in this sample the subcostalis muscle. The characteristic feature of this muscle is that it's located posteriorly, usually near the angle of the ribs, and the most important characteristic is that this muscle spans more than 1 intercostal spaces. That's to say, it might span 2 or 3 intercostal spaces. We can see this muscle in here, extending from this rib, crossing this rib, and going to the rib below. Also worth noting in this sample is that this loose tissue, which is peeled from the muscles, it's what's called endothoracic fascia. And deep to it, there is a parietal pleura. So we are peeling the parietal pleura, reaching the endothoracic fascia, and we said this is the subcostal muscle. If you can see this white glistening area in here, which is located posteriorly between the intercostal spaces, this is the area of what's called internal intercostal membrane. We said that the internal intercostal muscle extends all the way from the parasternal line anteriorly to the area of the angle of the ribs. It will be terminated in here and will be replaced by an aponeurosis called internal intercostal membrane. This is the chest, thoracic wall, and this is the sternum that's cut from the midline. We saw the subcostal muscle posteriorly, and we said the intercostalis intimi is located on the lateral side of intercostal space, and they have the same direction of fibers to the internal intercostal muscle. And this is the internal surface of the sternum. We can see some fibers or slip of muscles, which is called sternocostalus muscle. And this concludes the innermost layer of intercostal muscles.